Hello and welcome to today's program. Today what I want to talk about is in the spinal injury market today, we need standardized evaluation procedures. And what I mean by standardized evaluation procedures for a spinal injury, I mean that the evaluation procedure needs to be the same in any chiropractor's office, in any physical therapy doctor's office, in any medical provider's office. A standard examination for the damage to the spine in a spinal injury should be exactly the same, should be identical. The injuries are the same, the procedures for examination should be the same throughout all of the professions. When we have that in the market will dramatically change. Today, ligament injuries to the spine are the number 1, number 4, and the 6th leading cause of chronic pain and disability. Number 1 is problems with the lower back, number 4 is problems with the neck, and number 6 is problems with the neck leading to headaches. Now, these problems are ligament injuries. However, the problem in the market is that the market is not aligned in its procedures. You could go into 10 different chiropractic offices with a spinal injury and come out with 10 different diagnoses. 10 different workups, 10 completely different things identified. That's a problem in the market. There's no standardization and there's no codification in the market today. That's extremely, again, problematic. That's what's causing so much trouble in the market with patients not being able to get the care. Hello and welcome to today's program. Today what I want to talk about is the biggest problem in the spinal injury market today. And that's a problem with standardized procedures to determine the severity and location of a spinal injury. When you look at the market today, if a spinal injury patient, whether it's an injury that's caused at work, an injury that's caused by an auto accident, an injury that's caused by an injury to the spine at home, a sports-related injury, if you look in the market today, the workups for individual providers are all different. So if a spinal injury patient went into 10 different chiropractic centers, they're going to get 10 different workups, 10 different identified injuries, or no identified injuries at all, and just very generalized injuries. So today, the number 1, if a person injures their neck or injures their lower back, the number 1 diagnosis is a sprain. They sprained their lumbar spine. Now, if you injured your leg and a patient actually walked out of a doctor's office with the diagnosis of a sprained lower leg, lower extremity, a lower extremity sprain, there's not a doctor in the world that wouldn't wonder, okay, well, where in the leg is the sprain? A leg is a ligament condition, and a ligament condition is only involved with joints. So what joints in the leg are involved? Today, when people come out with spinal sprain diagnoses, whether it's from a medical doctor, a chiropractic doctor, a physical therapist, an osteopath, they come out with the diagnosis of lumbar sprain, cervical sprain, but there's no identified which vertebral motion units are sprained and how bad is it. So the problem in the market today is there's not standardized and unified procedures to diagnose simple spinal sprains or simple spinal ligament injuries. And remember, those ligament injuries to the lumbar spine are the number 1 physical cause of pain and disability in the world today and in the US. Ligament injuries to the cervical spine are the number 4 cause of chronic pain and disability. Ligament injuries to the cervical spine are also the number 6 leading cause, which is headaches. So what we need in the market today is standardized procedures. Standardized procedures. Ligament injuries are the easiest thing to assess. A spinal instability assessment. So a ligament injury to the spine causes spinal instability. And spinal instability is a clinical entity. When there's too much excessive motion in the spinal motion unit, and it causes irritation of the nerve. It causes a motor sensory or a pain problem. That's called a spinal instability. When the doctor who's treating that spinal instability turns off the motor sensory or the pain problem, the spinal instability is reduced now to just an excessive motion problem that many times is benign, and the patient can manage successfully through home exercises or some form of ongoing routine care of some kind. Oftentimes, though, they can manage it themselves. But the bottom line is that patient, I could send a patient into 100 different doctors' offices in the market today, and that patient would get a different workup everywhere. So today, it's time for us in the market to have standardized procedures. With the Smart Injury Doctors program, what we do is we teach doctors, and Smart Injury Doctors know how to do simple spinal ligament injury workups in the market. These are the doctors that employers should be looking for injured workers. These are the doctors that insurance carriers should be looking for on treatment in auto injuries. Anytime that the patient has a ligament injury to the spine, anyone who's in the market should be looking towards Smart Injury Doctors to, one, accurately assess and diagnose the severity and location of that ligament injury. Two, be able to treat it with great levels of success. Now, the big thing is the sooner that doctor gets this type of patient, the better. And the other thing they ought to be able to do is document with such simplicity exactly what is the problem with the patient and what are they doing for the patient, how are they responding to care. So it's the documentation that makes it easy for everyone in the market to understand exactly what the patient has and what they're going through. But today in the market, it's so easy to standardize. It would be so easy through medicine, chiropractic. If an injury patient goes into a chiropractor's office in the United States, the injury workup should be the same. The injuries are the same, the workups should be the same. It's time for the market to change and standardize its workup procedures. It's very, very easy to accomplish that today. All we need to do is understand what these injuries are in the first place, and that will lead to standardized workups. That will change. Standardized workups in the market would change the market dramatically, and that's what we're doing as Smart Injury Doctors. Doctors, I thank you for your time today on the short podcast. Each time I just go over a short subject, and I hope this information actually gives you something to think about, and I look forward to seeing you on the next program. Thank you.
You've been listening to the Smart Injury Doctors podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.